Hi friends, since January is the Glaucoma Awareness Month, as an ophthalmologist, I think it is my duty to let everyone around me be informed about what glaucoma is and what you should do to prevent vision loss because of this. So first, let us talk about glaucoma. Glaucoma is a disease in which the intraocular pressure, that is the pressure inside the eye, rises, because of which the optic nerve gets damaged. Now normally there's a fluid called aqueous humor which is produced in the front of the eye, and this gets drained through an area called the drainage angle. Now if for some reason, if either the angle is narrow or shallow, or if the sponge-like tissue in the drainage angle gets clogged, then the aqueous is not able to exit normally and it gets accumulated inside the eye, which causes the pressure to rise and damage the optic nerve. And once the optic nerve gets damaged, nothing can be done to restore it to normalcy. So that is the sinister aspect of glaucoma. So we need to get it diagnosed as early as possible to prevent this complication. So what you should do? You should first go to the ophthalmologist after 40 especially. And if you have a family history, all the more reason to do so. So you should get yourself examined for glaucoma. So your ophthalmologist will do a set of tests. Number one would be the intraocular pressure or tonometry. So this measures your eye pressure. Number two is the visual field examination. This is known as perimetry. So this is done to examine your peripheral field of vision, because this gets affected in glaucoma. The third would be the OCT optic nerve. Now OCT stands for optical coherence tomography. Now this is essentially a highly detailed non-invasive eye scan that uses light waves to create 3D images of the retina, which is the back of the eye. It is often used to check for eye diseases like macular degeneration or glaucoma. Number fourth is gonioscopy or measurement of the angle of the anterior chamber. This is done to find out if your drainage angle is narrow and liable to get occluded. The fifth test is pachymetry or measurement of the corneal thickness. Thicker corneas cause an overestimation of intraocular pressure, and thinner corneas cause an underestimation of the IOP. By combining the pachymetry results with the other tests, an accurate risk profile for glaucoma can be established. These set of tests will be done by the ophthalmologist, and once he does them, he will be able to know if you are suffering from glaucoma or you are a glaucoma suspect. In either case, he will either prescribe you some eye drops or do some preventive procedures like laser iridotomy, etc., to ensure that you don't get an acute attack of glaucoma or you don't suffer from the disease. So a follow-up is very necessary, and you should completely follow the treatment advice. If you continue to do this, rest assured you will have a lifetime of good vision. So please get yourself checked as soon as possible. Thank you.